SnapshotGLO is a powerful diagnostic imaging device. Clinicians can capture data by taking an image, just like a camera, and the results will show high bacterial loads as a glow on the screen. The device can be used at the bedside. It captures both a clinical image and bacteria image simultaneously and can help direct targeted patient treatments, ultimately improving patient outcomes while saving time and cost. It's a portable handheld device that uses autofluorescence imaging technology. Bacteria naturally fluoresce when excited by ultraviolet light. The device projects light on the wound and then captures the emitted visible light to generate images highlighting potential bacterial presence. In a single capture, SnapshotGLO takes a color image and a bacterial fluorescent image shown on the touchscreen side by side. Clinicians need more than just a visual inspection for assessment of infections in wounds. Bacterial infections are very common, particularly in diabetic foot ulcers, and up to half of wound care patients may not demonstrate signs and symptoms of a systemic infection, especially those with chronic wounds. Current assessment methods for identifying bacteria, like cultures, are time-consuming, costly, and invasive. But with SnapshotGLO, when interpreted in conjunction with clinical signs and symptoms, these images can help clinicians identify wounds with a high bacterial bioburden at the bedside. Take an image in 3 simple steps. Step 1. Prepare the room by turning out the lights or using the SnapshotGLO drape. Step 2. Use the indicators on the device to confirm light status and distance from the patient. Step 3. Take the picture. The device will process the information, and you will see both the clinical image and bacteria image results side by side on the screen. On the standard image, which is more like a photograph, clinicians can use the lasso tool on the touchscreen to draw a rough outline, then use the snap feature to get precise wound sizing. This is key for clinical review and documentation, which can be used for supporting medical necessity and tracking progress. On the fluorescent image, the glow may indicate harmful bacteria. High bacterial loads of over 10 to the power of 4 CFU or colony-forming units per gram of tissue are highlighted on the captured area in cyan or red fluorescence, depending on the native properties of the bacteria. SnapshotGLO can help inform clinicians about the location of bacterial bioburden, assisting in precise sampling or swabbing techniques if they are deemed necessary. They can preserve healthy tissue more precisely and provide targeted treatments more thoroughly, like debridement, topical cleaning agents, wound dressings, and determining antibiotic use. Clinicians treating diabetic foot ulcers, venous ulcers, burns, amputation sites, and surgical sites will all appreciate the time and cost savings of using SnapshotGLO. Clinicians can build rapport, gain trust, and patient buy-in. See beneath the surface. Seeing is knowing.